Hello and welcome to today's social media live on ageism. The topic today, ageism, affects many people around the world throughout their life. It can affect their health, their well-being, and many other factors. Today's discussion is a continuation of the discussion that we started last week when we launched a global report on ageism. I have today our expert with us, Dr. Vania de la Fuente Nunes, who's the Technical Officer, Demographic Change and Healthy Aging. If you would like to ask her a question, you can just leave a comment in the comment section, or if you're on Twitter, just use the hashtag AskWHO. Hello, Vania.
Hi, Walter. It is really my pleasure to be here with you and to have the opportunity to continue the conversation from last Thursday.
Great. We're really glad that you are here. As I mentioned previously, the report was launched last week, the global report on ageism. If you would like to have a look at that report, just go on our website, who.int, go to the health topic, aging, and you'll find it on that page. So maybe let's start with a really broad question. What is ageism?
Thank you for that question, Walter. Before I get started, maybe let me just say that age is really one of the first things that we notice about other people. And ageism arises when age is then used to categorize and divide people in ways that lead to harm, to disadvantage, and injustice. Ageism really refers to how we think, how we feel, and how we act towards other people, but also towards ourselves based on age. So when we talk about ageism, we're really talking about three different dimensions: stereotypes, so the way we think; prejudice, the way we feel; and discrimination, which is the way we act, again, towards other people, but also towards ourselves on the basis of age. I guess just to also add to this first question, I would like to say that we're not born ageist, but it really does start early on and is then reinforced over time. Children as young as 4 years of age are already aware of their culture's age stereotypes, and they then internalize those stereotypes and use them to guide their feelings and their behavior towards other people and also towards themselves. So again, we're not born ageist. Ageism includes three different dimensions. And I guess this is all for this first question. Thanks, Walter.
Yeah, thanks for answering that. So you mentioned already that it affects a lot of people throughout their life, younger people, older people, but who's particularly affected by ageism?
Thank you for asking this question. I think there's a common misconception that ageism only affects older people. And in fact, the word ageism is commonly used to describe, again, these stereotypes, prejudice, and discrimination towards older people only. But one of the things that we highlight in the global report on ageism that we launched last week is that ageism can be targeted towards any age group, and it affects mostly older and younger people. It is true, though, that the way that we may experience ageism may vary across our lifetime. And I'm really sure that everyone listening to us today has experienced at least one instance of ageism. So you may have been made fun of or ridiculed because of your age. You may have been denied access to healthcare or a loan because of your age, or you may have been denied a job because of your age. Again, there are many, many different examples of ageism across different sectors and institutions, and many different examples depending on our particular age at a given point in our lifetime.
Yeah, thank you for that. Actually, you just mentioned a job, and we already have one testimonial on social media from Diana, who's saying that as a mother of two young girls, she's 36 years old, and ageism has started to affect her opportunities to find a job. So I think that's one of the things that people often relate to, is the difficulty to find a job because of their experience, because people think they're too young, etc., or even too old. How common is ageism? Is it something that's rather rare, or is it common across the board?
Thanks, Walter. I mean, unfortunately, one of the findings from the report is that ageism is really everywhere. It's very common. We know that 1 in 2 people, or half of the world's population, is ageist against older people, with rates much higher in low and lower middle income countries. For younger people, we have less data, but in Europe, which is the only region where we have data available on all age groups, we know that younger people report more age discrimination than other age groups. The report also highlights that ageism doesn't only occur in our interpersonal relationships, so when we're in contact with one another, but it's also present across a large number of institutions, including the one you mentioned right now, so our workplace, but also our health systems, our legal systems, our financial institutions, the media, and many others. So again, ageism, I guess the common message here is that ageism is really everywhere.
And I assume because it's everywhere and it's so widely spread across different sectors, it also affects health and well-being differently. So how does it affect health and well-being actually?
Yes, so ageism is very harmful. And we dedicate a specific chapter in the global report on ageism to specify the effects that ageism has on our health and well-being. It has been found that it is associated, for example, with earlier death. So just to give an example here, a study that was conducted in China found that older people with negative attitudes towards their own aging had an almost 20% higher likelihood of dying over a 6-year period than those with more positive self-perceptions. Beyond this effect on our life expectancy, ageism is also associated with poorer physical and mental health, including, for example, the onset of depression. We're also more likely to engage in riskier health behaviors, like eating an unhealthy diet, smoking, and drinking. And with regards to our well-being, it increases social isolation and loneliness, and it also reduces our quality of life. So again, the effects of ageism on our health and well-being are very profound. And ageism is not only harmful in itself, but it also exacerbates other forms of disadvantage related, for example, to our race, our sex, and whether we have a disability, which make then the effects on our health and well-being even worse.
Mm. So you have a lot of different factors affecting your health and your well-being. Probably also your mental health. Is that correct?
Yep. So as I was mentioning, so one of the findings is that it also affects, for example, onset of depression, and it increases also depressive symptoms and lifetime depression. So very clear effects on our mental health. It can also decrease our cognitive performance, for example, in older age. So again, many different impacts across different aspects of our health.
Yeah. And you mentioned previously that it affects both younger individuals, maybe something that we are not particularly aware of because of the name ageism. We automatically associated it with the older individuals. How does it impact younger people?
Yes. I mean, so ageism, as I was mentioning at the beginning of the conversation, it can change how we view ourselves and really limit our opportunities in younger age if we internalize certain stereotypes about what we can and can't do. So, for example, if I internalize the stereotype that younger people don't have anything relevant to say and that they shouldn't be advocating for specific things that matter to them, I may be then less likely to voice my opinions, for example, in the workplace among colleagues. We also know that in younger age, we encounter ageism across different institutions and sectors. For example, in the workplace, ageism tends to manifest more once we're employed in terms of our pay and benefits for equal work done, for example, by someone else who may be older. Younger people also tend to be perceived as incompetent in the workplace and tend to be subject to belittling comments. This has an impact on their commitment to their workplace and also their level of satisfaction with co-workers, for example. In terms of other institutions, we also know that ageism takes root in the legal system, where crimes committed by younger people are perceived to be more serious transgressions and are also considered to deserve more severe punishment than those committed by older people. Another very important sphere where we see ageism affecting younger people is in politics, where there's a tendency to really doubt, deny, or dismiss their voices and to limit any efforts by younger people and youth to advocate, so to start political and advocacy movements. So again, it is present across different institutions, and it really affects younger people. In terms of the impacts, we know a lot less than we know, for example, about the impacts of ageism against older people. So this is really an area where we're hoping to get more research.
And it's also kind of a snowball effect, or if you once you get rejected because of your age or you're not being taken seriously, then it affects you more and more the more it happens.
Yeah, I mean, the more we encounter these stereotypes and we're confronted with this prejudice and discrimination, of course, because this is so prevalent in our society, we're more likely to then internalize that and eventually self-direct it. So, yeah.
And then it probably also has long-term repercussions, right?
Yeah, as I was saying, we know a lot more in terms of its effects in older age. We know less, unfortunately, in terms of the impact that it has on younger people, but we're hoping that more research will be done in this area so that we can learn a bit more about not only as it affects younger people now, but also the long-term effects that can have even once you reach older age. So encountering really ageism across our lifetime is obviously likely to have very specific impacts at specific points in time, but also throughout.
I would like to just mention one comment that we received on Facebook from Sean, who's saying that age is just a number and people should not be defined by a number, but by their experience. So maybe trying to stay positive that way. Now, if we move away from the impact of ageism on younger people and move towards older people, what kind of repercussions do we know exist there?
Yeah, so I mean, here the report found that ageism against older people is really everywhere. It's in healthcare, it's in workplaces, it's in financial institutions, it's in the media. So for example, we know that ageism is in policies that support healthcare rationing by age. And here, the findings are alarming in the sense that 85% of the 149 studies that looked into this found that age determined who received certain medical procedures and treatments, like dialysis, ventilator support, etc. Ageism is also found in practices that deny older people a job or a loan because of their age. We also see in the media where there's an incredible underrepresentation of older people and a negative portrayal of older people. We know, for example, in Hollywood films, this especially affects older women. Mm-hmm. We see that dialogues, so the amount of dialogue that's given to women really decreases as they get older. So we know that I think it was women between the age of 21 and 34 normally have 38% of dialogue, and that is reduced to 20% by the time they reach their 42nd birthday. So again, we do see that ageism is everywhere. And we also know that the impact of ageism against older people is very negative. As I was mentioning, it's associated with poor physical and mental health, earlier death, increases risky health behaviors, in social isolation and loneliness, and it also reduces our quality of life. So again, it's not only that we see it everywhere, it's also that it really affects our health and well-being.
Yes, it's actually interesting that you just mentioned TV and movies, because we just had a comment from Peter on Facebook mentioning just that there's a lot of ageism in this sector. We also have a question on Facebook. The question is, do you think the world population is getting more aware of the problem of ageism?
Thank you very much for that question. I think the COVID-19 pandemic, for example, has really made ageism visible and more tangible in people's lives. So I think it has helped in a way to increase visibility to this important issue. Age has been used in some contexts, for example, as the sole criterion for access to medical care, to life-saving therapies, and for physical isolation measures. So for example, we've seen that in some contexts, only people over the age of 70, for example, were asked to self-isolate for several months. Once lockdown measures started to be lifted across some countries, we also saw that only older people were asked to remain at home or were denied access, for example, to public transportation, to malls and restaurants, which of course limited their ability to get basic supplies like groceries. It also limited their ability to maybe access healthcare. So again, I think the COVID-19 pandemic has really made ageism visible. We've also seen, in the context of this year, older and younger people being stereotyped very heavily in public discourse and social media as homogeneously frail and vulnerable, or selfish and invisible, which fails really to recognize the great diversity that we see both in younger age and in older age, and which also creates harm. We know that even very brief exposure to ageist stereotypes in the media has a negative impact, for example, on older people's performance on memory tasks. So again, unless we change this ageist discourse, and unless we ensure that our policies and our laws protect against age-based discrimination, we will not be able to live in a world for all ages. So I'm really happy that you're all here with us asking these questions, because I think jointly we can really create that world for all ages.
Okay, thank you. Just a reminder for our audience, our topic today is ageism. If you would like to ask a question on that topic, please just leave a comment, or if you are on Twitter, just use the hashtag AskWHO. Maybe just to rewind a little bit, Vanya, if you could remind our audience what ageism is for those who just joined the conversation now.
Of course. When we talk about ageism, we're really referring to the way we think, the way we feel, and the way we act towards other people and also towards ourselves on the basis of age. So we're really talking about three different dimensions. Our stereotypes, so the way we think, prejudice, the way we feel, and discrimination, or the way we act.
Yeah. You previously mentioned COVID-19, and I don't want to make you repeat yourself, but you mentioned how COVID-19 made ageism visible. But did the pandemic also make ageism worse?
We don't have that much data on it. I mean, I can't say that the pandemic has made ageism worse. I just think, and it's not like ageism started during the pandemic. Ageism is something that unfortunately has been with us for many years. But it is true that I think in the context of the pandemic, it has become a lot more visible. There's a saying that says that if we can't see a problem, we can't fix a problem. I think the pandemic has made ageism very visible. It has made us very aware that it is there. We have seen our grandparents, for example, facing issues when accessing certain things. We have seen ourselves then being stereotyped in media. And I think that now that it has been made that visible, and now that we have the tools to actually do something about it, so the report does specify what can be done to effectively address ageism, we can really start working together to create a world for all ages.
Yeah. And what would you do, or what would you recommend to have a fairer world where ageism is not that big of a deal, big of an issue?
Yeah, so I mean, just to say that I guess the overarching message of the global report on ageism is actually very optimistic. We can combat ageism, and three strategies have been found to work in addressing ageism. These include policy and law, educational activities, and what are called intergenerational interventions. Policy and law can help to address discrimination and inequality on the basis of age, and really protect the human rights of everyone, everywhere. In turn, educational activities can help to enhance empathy, dispel misconceptions about different age groups, and reduce any prejudice that we may have by providing accurate information and counter stereotypical examples. They can be included in all types and levels of education, and in both formal and non-formal education settings. The last intervention that was found to be effective are intergenerational interventions, which bring together younger and older people, and which can help to reduce intergroup prejudice and stereotypes. These are really among the most effective interventions to reduce ageism against older people, and are showing a lot of promise for reducing ageism against younger people. I must say that, I mean, the three strategies that have been found to work to address ageism are pretty affordable, and they're in our hand as well to take steps to implement many of them. So for example, it's in our hand to engage with younger and older relatives, or younger and older friends, to make sure that we challenge any stereotypes that we may have in relation to age.
You touched upon education in your reply. We've got a question from on Facebook from Anupama. Sorry, she's asking, "Does ageism affect academia?" And maybe you can expand on it by also telling us how education can help to prevent ageism.
Yep. So I would say that ageism, I mean, because we were saying that it affects us everywhere in different institutions. It also does affect academia, not only in, for example, access to lifelong learning for older people, for example, but also in terms of the constructs that are used in academia. So, for example, the use of the dependency ratio as a construct in some of the research that's done is actually perceived to be quite ageist, because basically it assumes that all older people above the age of 60 are dependent, which of course is a misconception and not the reality, especially now with longer working lives. So again, there's a lot of work that we can do in the way that we conduct research, and there's a lot that we can do also in the way that we provide access to lifelong learning to different age groups.
Mm-hmm. And while we're talking about preventing ageism, what can individuals do within the community to prevent ageism?
I mean, I think there are different things that we can do within our communities to prevent and address ageism. I would say, going back to what I was mentioning in terms of the effects of intergenerational contact, I think we can all do more to foster relationships with older and younger relatives, with older and younger friends. This is a very effective strategy, and it's something that we can all do quite easily. I think it's also important to continue this conversation in our communities. So to talk at home with our families and friends, to talk in our schools with our students, to talk in our workplaces with our employers, to really change the narrative around age and aging. To help support these conversations and these actions, we've created a very rich toolkit that's available in English, French, and Spanish. That includes, for example, a guide that can be used to prepare your own events. It also includes conversation guides that can help you spark those discussions with different people in your networks, as well as a very comprehensive social media guide that can help you spread the word beyond your immediate context. I'm sure many of you have seen a lot of buzz on Twitter, Instagram, and Facebook with the strong messages of the campaign. And we really hope that you can continue to spread the word using the hashtag A World for All Ages.
Great. You previously mentioned laws, how laws are affecting ageism. And we've got a comment from Facebook from Bilal, who's saying laws also creating aging discrimination in terms of employment rules and other rules related to government affairs. Can you maybe give us some insights how governments could maybe tackle the issue?
Yep. I mean, governments are key in taking forward any of the 3 strategies that we know work in addressing ageism, and which I mentioned earlier. Governments can draft and implement laws that prohibit discrimination on the basis of age, and they can also put in place adequate enforcement mechanisms to ensure the application of those laws. They can actually also modify any laws that may, or policies that may exist in a country that may actually lend themselves to discrimination on the basis of age. Governments can also implement educational activities that enhance empathy and dispel misconceptions across formal and non-formal educational sectors. And they can also provide resources for the implementation of more structured intergenerational contact interventions. So again, the role of government is key also in taking up the key strategies that have been found to be effective and that we mentioned in the report.
Yeah. And as you mentioned the report, for those who are interested to have a look at it, please go on the website, who.int, go to the health topic, aging, and you'll find the report there, which was launched last week. Maybe just to wrap it up almost, what is WHO doing to support countries and individuals to tackle ageism? Can you tell us about that?
Of course. WHO is really working together with different partners on this global campaign to combat ageism. The vision of the campaign, as you may have gathered by now, is really a world for all ages. And the mission is to change the narrative around age and aging. As part of this campaign, we have worked very hard to produce the first UN Global Report on Ageism that we just launched, as well as the comprehensive toolkit that aims to support everyone, wherever you are, to take action to create a world for all ages. We're also working to develop a better instrument to measure ageism across countries. We're mapping who is working in this space to create a global movement to change the existing narrative around age and aging. And I really invite you to go to our website and let us know any work that you're doing in this space. We're really keen to learn about what you're doing and to draw from it so that we can jointly work on this movement. And finally, we will be working together with key stakeholders to make sure that the strategies identified in the report are taken up across countries to combat ageism.
Great. We have a question on social media. Somebody's asking if ageism has increased in recent times, or if it's a new phenomenon, or if it has always existed. What's your take on that?
Thank you so much for that question. I mean, what I can say is that global data on historical trends in prevalence are lacking, but there have been a number of studies that are also referenced in the report, which have looked at the evolution of the use of, for example, the English language from 1810 to the 2000s, so from really the 19th century to the 21st century. And what they have found is that, unfortunately, negative age stereotypes have increased over time. And there was a time where age stereotypes were more positive, and then from around the 19th century, they started to become more negative. There's also studies that have looked at the use of language in fictional and non-fictional works, and here they have not only seen also an increase in negative age stereotypes, but also that younger and older women tend to be underrepresented, which highlights the intersection, for example, in this case, between ageism and sexism.
Vanya, thank you so much. We almost came to the end. Do you have any final words of wisdom that you would like to share with our audience on the topic of ageism?
Thank you so much, Walter. No, I mean, it's really just been my pleasure to have the opportunity to continue the conversation about ageism with all of you here today. And I really hope to see you join the movement to create a world for all ages.
Thank you so much, Vanya, for joining us. For all of you out there who are watching us from around the world, we've got a lot of people watching, including countries like Sudan, India, South Africa, Nigeria, Cameroon, Uganda, Philippines, Denmark, Hong Kong, Zimbabwe, Nepal. We are really happy that you join us today, and please tune in next time for the next social media live. Until then, stay healthy. Goodbye.